My name is Dennis Durbin, and I serve as the Chief Scientific Officer at Nationwide Children's Hospital. And it is my pleasure, on behalf of the Abigail Wexner Research Institute here at Nationwide Children's, as well as the Ohio State University Center for Clinical and Translational Science, to welcome you to today's Inventor Showcase. One of the things that I enjoy the most about working at Nationwide Children's is that one of our distinguishing features as both a hospital and a research institute is our focus on translation of all of our discoveries and innovations into novel diagnostics, therapeutics, policies, and practices to impact child health. And today we're going to see a really terrific example of that that we can highlight. Success in translational science requires both an interdisciplinary scientific team, again, an example of which we will see today, as well as several specialized institutional resources, particularly in regulatory affairs, product development, clinical trials, and in technology commercialization. And I'm pleased that you'll be able to meet several members of our truly outstanding Office of Technology Commercialization here at Nationwide Children's. We really punch above our weight, as they say. Nationwide Children's has developed 16 startup companies from discoveries made here and counting. We are the second leading children's research institute in the United States in terms of number of licensing deals and licensing revenue over the past several years. And 15 of our faculty were issued patents over the last 2 years. These are really just tremendous metrics of our success in the area of translating our discoveries and partnering with commercial entities in order to bring those discoveries to the bedside of as many children as possible. And the CCTS award that we participate in with Ohio State really helps to support many of these institutional resources and has really helped to create an ecosystem of innovation here, encourages and supports our faculty to innovate in any place that they can, and then to partner with commercial entities to bring their insights to realization. And so it's my pleasure to introduce today's team. It'll be led by Dr. Prashant Malhotra, who is an associate professor of otolaryngology here at Nationwide Children's Hospital. He will kick off today's discussion and introduce the other remaining members of his team. Over to you, Prashant.
Great. Thank you, Dr. Durbin, for the kind introduction. I'm going to get these slides started here. Great. So I'm Prashant Malhotra. I'm at Nationwide Children's Hospital and faculty at Ohio State. I'm a clinician. I'm a surgeon in the pediatric ENT department and in the hearing and cochlear implant at Nationwide Children's implant program. So my primary career, passion, clinical, and research interests are focused on caring for children who are deaf and hard of hearing. And I'm fortunate to have undergone an invention journey over the past, seemingly at this point, improbable 6 years. Each new step forward has been made possible due to the extensive resources at Nationwide Children's Hospital and Ohio State that I've been able to take advantage of it. And because also because I'm one part of a wonderful innovation team that I'd like to briefly introduce. We have 5 inventors of our technology, which is, as you see here, is titled Hear Me Read, a novel digital storybook intervention platform for children with hearing loss. Janelle Hufner is a speech-language therapist at Nationwide Children's Hospital in our hearing program and a parent of a child with dyslexia. Shanna Lucius is a speech-language therapist at Children's in our hearing program with special additional training to work with kids who are deaf and hard of hearing. John Luna from the Research Information Solutions and Innovation section of the Research Institute at Children's is our interactive media designer. I've already introduced myself. Dr. Anand Satyapriya is an anesthesiologist and also the parent of a deaf and hard of hearing child. I'll let Anand begin the telling of this invention story as the inspiration first came from him.
Thank you, Prashant. I'm going to start this talk off with something different than others have done in the past. I'm going to ask everyone to do a quick exercise with me. I know it's virtual, so I'm going to imagine you guys are doing it. I want everyone to close their eyes and remember or imagine they're about to have their first child. I want people to think of all the emotions that are running through them: nervousness, stress, excitement. There's worry, but not about your child. It's about you as a parent. Why would you ever think something would go wrong? Up until now, it's all gone right. The ultrasounds, the blood tests, the prenatal visits. And then the moment comes, your baby's here and it's just pure joy. You survive the first night, you think to yourself, I can do this, all smooth sailing from here. Then the news comes, your child has failed their hearing test. Your joy turns into devastation. You deny it. It can't be true. It's a false positive. Hearing loss doesn't run in this family. Everything else has gone right. A week later, you're in an audiologist's office. To be frank, you didn't know what an audiologist was. It's confirmed. And you're lost, not knowing the faintest idea of how to deal with the situation. Everyone can now open their eyes and try to think of what they would do facing this news. This valley in my life is what has led to my motivation for this project. My wife and I quickly realized that critical to our son's success was not only the access to sound through hearing aids and eventually cochlear implants as he lost all his hearing, but intensive speech therapy with highly trained verbal therapists. And through that therapy process is how this idea was born for Hear Me Read. As I started to think more and more about this idea that would help my son and other hearing impaired children navigate the therapy process more efficiently, I realized I hadn't the faintest idea of where to begin or how to begin. And that's when I approached Prashant, my son's surgeon, to brainstorm about the project, as I knew his motivation, and eventually our whole team's motivation, was in the same place. He has built his career on helping hearing impaired children, so I knew his heart was in the same place as mine. So we met up at a coffee shop one afternoon and we sat there mulling over it. And we realized we didn't know anything about entrepreneurship. So Prashant thought our best option is to utilize the resources at Nationwide Children's Hospital, specifically the Office of Technology Commercialization. And that is where we met Andrew Corus, and we've been tremendously lucky to pitch him our idea, no matter how rudimentary area it was at that time. Because I think he believed we had the right motivation to see the project through to success, and I can easily say that we would not be at a minimal viable product right now if it wasn't for the Office of Technology Commercialization and the access they gave us to their resources, such as CCTS, Resi, and TDF, along with pushing us to different phases and continuing to believe in us. I'll now pass it along to Prashant, who will discuss our story further.
I remember our meeting in Starbucks well. I reflect back at that at times. It was weird for me to meet a parent of a patient of mine in a non-clinical setting. And it was another leap to commit to taking on a project that had no clear path. We just did it, and I'm glad we did. What Anand articulated and knows so well is the challenges faced by kids who have hearing loss and their parents. It's not the same as an adult or your grandmother who has hearing loss and then loses some of it. The impact on a child who has so much development to yet undergo is far greater. The children who are deaf and hard of hearing face many challenges, but we are focusing on those regarding spoken language and literacy. And my interest in literacy is rather odd for maybe a surgeon, but I'm passionate, however, for advocating for deaf and hard of hearing kids overall, and it goes beyond just surgery itself. When a family learns their child is hearing impairment, the mind races, as Anand described. So they really want to know, can kids learn to speak? Will they read? And this is where we came in here with this idea. So when it comes to literacy specifically, there's very little data, a huge variation in outcomes, and very few interventions focused on kids who are deaf and hard of hearing. So, so the why do we need a Hear Me Read, right? At present, I think it's pretty clear that these kids are at risk, and they often need frequent in-person therapy with a pediatric hearing loss expert. These are clustered around big cities, and most kids can't get access. We know that storybooks are emphasized by national literacy and education experts to be important for enhancing young children's literacy. And we commonly use these for kids who are deaf and hard of hearing as tools during therapy, right? And so novel digital interventions present an opportunity to us to extend therapy for kids who are deaf and hard of hearing. And currently no digital therapy interventions designed for deaf and hard of hearing children exist. Parents are looking for these. So To address these challenges faced by deaf and hard of hearing children, our study team developed a novel app called Hear Me Read. It's an iOS-based software application that enables parents and speech language pathologists to partner together to help deaf, hard of hearing children achieve reading, speech, and language goals through an interactive and digital storybook reading tool. There's audio and visual strategies built into this. Currently, it's guided by a treating speech language therapist who knows the child's goals and therefore can individualize targets and goals through this app using the storybooks. One of the big advantages of this app is that it's one app for all ages and all learning styles. And for kids who have a huge diverse abilities when it comes to communicating and reading and listening, this one app can take care of all of that. And Anand, will describe how he's had to use multiple numerous apps as his efforts to try to help with his son, Arjun. I created an Inventor Timeline to give you some history of this project. We've talked about the inspiration. If you look, I think the willingness to take any next step was probably the most critical. Nothing else could have happened next if we hadn't. And we felt wholly unprepared as clinicians. So our first concrete step was choosing to reach out to the Office of Technology, Commercialization at NCH to discuss our concept. Andrew Kors has been a consistent guide for us since then. And we signed non-disclosures and he supported our decision to proceed. I do think it was also a crucial decision at this time to stay within the NCH and OSU umbrella rather than strike out on our own. Certainly you give up a lot from an inventor ownership standpoint is what we're thinking, but I think this project would not have been successful if we had tried to do this on our own. As you will see in our timeline, our benefits included exposure within and outside of the institution, which led to funding and commercial interest. And it gave us a pathway to success in an arena that I don't have any expertise. Patent processes, market analysis, all of these are costly and difficult to do on your own. I'm a surgeon, I'm a husband to a full-time physician wife, and a father of 2 children who I like to try to spend some time with. So reinventing a wheel takes too much time from me. Our first seed money in 2016 came from OSU in the form of a CCTS voucher. This was easy to get and allowed us to make a storyboard for our idea. We took our storyboard and presented that to the Technology Development Fund, a group of investors that to us felt like Shark Tank style, who are interested in emerging technologies. We did not get funding. However, the presentation did give our idea exposure within Nationwide Children's Hospital and allowed 2 significant major developments to occur. A contact with Highlights, a Columbus-based company that you may be familiar with, that overlapped our space, and with whom then we created a collaboration for our digital content. Our exposure through the OTC and TDF also brought the project to the attention of the NCH Foundation, who was interested enough to offer our first funding to start development of our prototype. Now we could really get to work. So Janelle and Anand are going to discuss some of the steps that we took with our early prototype and working with our primary target consumers, speech and language therapists and parents. Through these, we found that they valued the technology, which helped us keep momentum to go on. We also sought specific feedback and user testing on Hear Me Read, which we incorporated iteratively as we developed it further.
Yes, I am one of 2 speech language pathologists on the team. I'll share just a little bit about Shana and myself, and then I'll talk about that work that we've done with the prototype. Shana is truly a valued colleague here at Nationwide and on this team. She has rare certification as an auditory verbal therapist, and that's considered to be the gold standard in language and literacy intervention for children who are deaf and hard of hearing and who use hearing technology. I've been a speech therapist for a number of years, and I have gone on to receive advanced certification in literacy based on Orton Gillingham, which happens to be the gold standard in literacy intervention. It's fairly uncommon for someone to specialize in working with children with hearing loss and also have this advanced training. And I'm super happy to be able to share my knowledge with this team. I developed my interest in pursuing literacy certification when my daughter struggled to read really early in elementary school. I knew it was not working for her the way it was with her peers. She has since been diagnosed with dyslexia. And I think that really drives my passion and the work that I do on really at Nationwide and on this project. I really am interested in helping as many children as possible learn to read despite the reason for the struggle. So I joined the team in 2018, kind of late to the game. I had just relocated to Ohio from New Jersey. Shortly after I arrived in town, I met Shana and Prashant at a collaborative meeting with a number of community stakeholders. And because of a conversation at that meeting, the course of my career changed. I thought I might continue on the path of working in the school district, but that conversation was really about the struggle that kids with hearing loss have with literacy and language development. And they encouraged me to join the team here at Nationwide, and I loved the idea. So I was able to join the team early in 2018. And then from that time, Shane and I really worked closely on developing content for the app, in addition to what we were provided through highlights. I do think that we bring some unique perspective. Shana works with younger children who are in the early stages of language and pre-literacy stages of development. And then I work with older children who are really struggling with reading and are in need of remediation of literacy deficits. So in addition to that content development, we also support the user trials that Prashant has mentioned, and I'll talk about that here on the next slide. So I also want to mention that we have access to a very large team of speech pathologists here at Nationwide. And I think that that's been a huge part of the success of these trials. Let's see, so the initial therapist parent survey was done in 2018 with speech language pathologists within the hearing program. And then we did a parent-child focus group in 2019 in collaboration with John and his team at Resi. And out of that focus group, we were able to publish an article titled Usability of a Mobile App for Improving Literacy in Children with Hearing Impairment, a focus group study. And then this year, Shane and I were working with therapists across our department, and we're able to get some really great feedback from them this year. And then I just wanted to share that I think all of this success that we had with those groups were largely in part because of the support we had from our leadership team. And I think that same support is going to be really critical in the success of our clinical trial that Prashant will talk about here in just a few minutes. Let's see. So lastly, I just want to share that I'm super excited about this project for a number of reasons, but I think partly because of the feedback we've received from the speech therapist with both times that we asked them for interaction with the app. Early on, the hearing program speech therapists expressed that they were excited about the functionality and that they really were looking forward to using it with their patients because of the impact it could have. And this year, as we opened this up to the broader group of speech language pathologists who don't necessarily have specialization in hearing and working with children with hearing loss, we got some great feedback there too. They were provided with video and like written tutorials that John had created. And then we had created some open and closed-ended questions that we wanted them to respond to as they interacted with it. As a result, the participating therapists gave us some really great suggestions for improving the usability. And then they also expressed their excitement about using this beyond what we had initially targeted. So that's all really positive. I'm excited personally for a number of reasons as well. I think that the app has huge potential beyond the target. I think if we expand the content and we could reach a lot more children, especially those children who are struggling to read because of dyslexia. And I do think that this app is critically important in helping to close the gap between what we see where children with hearing loss are in terms of their language and literacy and where they really need to be to catch up with their hearing age peers and to close that gap so that they can be successful academically. So with that, I'm going to turn it back over to Anand, and he's going to share some of the parent feedback that we received from that 2019 study.
Thank you, Janelle. So during this user trial, we also interviewed parents of children after they utilized the app. And yes, there were some concerns about the functionality, such as swipe buttons, making it more user-friendly to record videos, making it easier to get back to the home screen. But honestly, we expected that at the current phase we were in. I think what we were most excited about was the fact that there were only positive comments regarding the content and applicability of the app, such as there aren't apps out there like this. There's apps that aren't as comprehensive. It can help my child on different parts of speech. I could use this with my normal hearing children. I could use this app for other children in speech therapy, like children with dyslexia. Obviously, I'm biased, but for parents that are doing this type of speech therapy, they realize this app could solve three major issues. One, access to these highly specialized verbal therapists, mainly centered in the big cities, about a dozen in the state of Ohio only. And imagine if you're living in Lima, Ohio, driving an hour to and fro, and you have to do weekly therapy sessions. This was a concern even for me living in Columbus, trying to fight through traffic after work. And as the next slide shows, and this feature comparison chart shows, there are a multitude of apps out there. The major issue when dealing with hearing impaired children going through intensive speech therapy is you're dealing with different parts of speech on a weekly basis: articulation, phonics, phonemes, verbs, adjectives, plurals. And every week you're downloading a new app. That's not evidence-based to try to attack your child's goal. That's the beauty of our app. It's all customizable and individualized on what the child needs to work on that week, and all done in an evidence-based manner, utilizing proven methods of speech therapy and other methods like dialogic book reading and parental involvement at a young age. And then three, lastly, the big players in the educational space like Epic and RazKids don't have a niche for hearing impaired children, which is our team's expertise and passion. With that, I'll pass it back to Prashant.
Thank you, Janelle and Anand. So I'm going back to the timeline slide here, so you can see where we went from there. Through some external facing marketing through OTC and NCH, we were approached at this stage by an outside company that had some commercial interest. We successfully, in the end, they did not pursue licensing, but this reassured us we were sort of heading in a promising direction. So each time we inquired, we seemed to get some positive feedback that we should continue to go. And I got to tell you, as busy as we were, I mean, it was nice to get that to move forward. The past years in 2020 and 2021 seems to be a time when our project has really blossomed. So we successfully secured a second CCTS voucher to help us polish up our app. We were then ready to try our hand at the Technology Development Fund again for a second time, 4 years after the first time. We were pleased to be awarded funding this time, and which allowed us to add some functionality and upgrades requested by our parent focus group and the speech therapists. And after all this development, we finally felt that sort of our technology is at a minimal viable product kind of phase. So we filed for a provisional patent through NCH this year. And finally, as you can see, we have all of these different steps we've gone through, and we're seeing success. But our primary goal is to create something that we all feel can positively help children who are deaf and hard of hearing. So all of us are devoted to healthcare. While we have created something we felt sure could now be spinned off, we do feel strongly about proving that it works before selling it. We want to set ourselves apart from others in this tech space and be true to the identity as researchers and clinicians and academic innovators. So we applied for and recently were awarded funding through the NCH intramural grant for a prospective clinical trial in children who are deaf and hard of hearing to determine evidence of efficacy. This is just a quick design summary of our trial, just to kind of give you a sense. But we are going to investigate how our app might improve standardized speech and literacy outcome measures. So we're still learning and have much to do, and will continue to need help. Our next steps are to create a business entity. We may also end up applying for an SBIR, STTR funding mechanism after results from our clinical trial. With each success, it seems like there's possibility for more success, but more work. However, this is rewarding and helps, I feel like it helps use a creative part of the brain I don't get to use very often, and it's exciting for me. So it's kind of one of the ways it keeps me going. A final comment, we have, in putting together these slides, I realized how much help we had along the way. As a busy clinician who had a very full-time job, a wife, kids, as I mentioned, I didn't have the time or knowledge base to devote to making this happen on my own. This invention could have died so many times. I know my limitations, and I'm glad I sought help many times. And a team, as the people you have heard here, who fill in all the areas that I could not. And I'm grateful that the help has always been here at NCH and at Ohio State. each of the smallest successes motivate us to continue to bigger ones. So I want to take a moment to acknowledge the efforts of all the humans involved in this project, our families who supported us, leaders in our departments in ENT and clinical therapies at NCH, for the leadership at Highlights for Children who helped us really launch our first big obstacle, overcome our first big obstacle. A special thanks to those at Resi at Children's. The project managers there were very organized, and their expertise helped keep this technology-based project on track. We're grateful for the funding received by the NCH Foundation, Technology Development Fund, and the CCTS at OSU. And finally, our guides along this innovation process have come from the Office of Technology Commercialization at NCH. I want to thank Matthew McFarland and Andrew Corus for believing in our invention and leading us through this quagmire.
All right, well, thank you very much, Prashant, for that kind introduction. If we were in person together today, I would ask the entire room to give a round of applause to the Hear Me Read team. I'm humbled by the work that this team has done and put together. And, over the next few minutes, Andrew and I are going to talk about some of the resources out of OTC. And the reality is, none of those mean anything without the passion of the investigators and the innovators that we get to work with. And so this team is a tremendous example of where, people who really care a lot and are passionate about what they're trying to do can make a difference and are making a difference. So thank you for sharing with us today. It's really a great thing to get to hear. Andrew, my colleague and I, Andrew Corus, are going to tag team the next 10 to 12 minutes or so, talking to you about the Office of Technology Commercialization. And it's really probably going to be more of an advertisement and an information sharing than it is a total presentation digging deep into our function. But I'm going to take just a moment, if we could go to the next slide, and introduce our team, and then I'm going to hand it off to Andrew to talk a little bit about what it's like to interact with us. And then I'm going to talk just a little bit about some resources. So our team in general is structured with two different groups of professionals. We have our licensing associates, who you see are our licensing professionals, who you see along the top of the slide here. These are primarily people who are working in a space that they have technical training in, or they have advanced technical degrees. And the importance of their role is not just to think through kind of the business structure and some of the deal structure we put together, but also to understand the different technologies and the technology applications. And then I also want to introduce, kind of primarily along the bottom line of the slide here, what I would call our operational staff. And these are individuals who may not dig deeply into the technology and how the technology works that we're dealing with, but have become experts in different areas that are so critical to commercial success, whether that's intellectual property or compliance and disclosures or marketing efforts and different agreements that are necessary to enable what we do. And so, just thank you to everyone in the office and everything they do. At this point, I'm going to turn it over to Andrew Corus to talk a little bit about what it's like to interact with our office. So next slide.
Thank you, Matt. My name is Andrew Corus. I'm one of the senior licensing associates in the Office of Technology Commercialization here at NCH. And I'd just like to take a moment to thank the Hear Me Read team, as well as the CCTS team, for inviting us to speak. It's always a pleasure. I think what we do is very interesting, and it kind of sometimes is in the background of a lot of our cool and strategic things that we do at NCH. So if you'll permit me, I'll tell you a little bit about exactly what happens in the background. There are some aspects of it that get a little bit technical or might even be a little bit dry, but I promise you, if you're interested in commercialization or you're interested in the process at all, knowing this is really going to help in realizing what your goals are for a technology. So our process is inherently cyclical. Our goal at NCH is to guide technologies that help children into the hands of the highest value commercial partner or sister institution. And to do that, we have to subscribe to this iterative process of analysis and support of new technologies to prepare them for their transition to industry. The process typically begins with an invention disclosure, which is a formal report that provides our office that's provided to our office from the invention team that includes all the information that's necessary to assess the legal and technical risks, as well as to discharge any government reporting duties. For example, the technology may have had grant funding that includes intellectual property obligations, or might incorporate biological materials that are owned by another institution or a commercial partner. If we're going to give the technology the best chance of success, we have to know about those things and reconcile them prospectively, or else we risk those third-party responsibilities scuttling the entire project. And it is very common for technologies to have some aspect of this. I would say a good portion of the projects that I work on have one or two obligations that need to be reconciled, and they can really be opportunities. It's not me being optimistic. It's just that the more people that are involved in a project increases the chance and the scope of our connections. And if I really appreciate Prashant's whistle-stop tour of the commercialization process, because you could see throughout that process, which spanned 5 years, there were many places where there was an issue or something that needed to be to fix, and we were able to turn those around. And it's I think that's one of the more strategic aspects to what we do. And it's something that I'm happy to do. After we reconcile those third-party responsibilities, the technology is assigned to someone like myself who performs a survey of the patent and scholarly literature. It's called a prior art search. Prior art is a patent term that means basically anything that a reasonable person with reasonable skill in the art would know, which means essentially everything. As kind of an aside, prior art can not just be patent literature, but it can also be things like a picture in a magazine. There are examples of things not becoming patentable because of Donald Duck cartoons. So you really have to cast an incredibly wide net, and you're going to find something. And that doesn't mean that you don't do it. It means that you progress with that information and are bolstered by it. The search will help identify those things that we need to work around, and we use that and disclose it actually to the USPTO, the Patent and Trademark Office, as necessary, and actually strengthens our IP position. That's also the time that we would engage with Patent Counsel. We at NCH use Patent Counsel externally that has a subject matter expertise close to the invention team. We find that gives us better patents. And we will typically do a provisional patent application. In this case, it was pretty far along in the invention process before we did that. And that is common. We want to make sure that we have all of the cool pieces and parts and secret sauce before we move forward, so that we have the strongest IP position possible to attract a licensee or business leadership. We also do passive marketing and targeted marketing at the same time. One of the more potent forms of passive marketing we do is through an annual physical and digital publication called Technology to Transform, that has a small vignette about all of the available technologies that we have. We also do targeted marketing through events that we invite our industry and other partners to, as well as sponsoring site visits to NCH. And it's important to point out that licensing can occur anytime during this process. We've talked about licensing, and one of the things that I wondered about when I first came into licensing is why we license things. Why don't we sell them? And it's because licensing is a revocable privilege. And as a nonprofit pediatric research institution, we want to make sure that the things that we are licensing are being used in a way that comports with our mission. And we do that by providing obligations to the licensee. And if they don't meet them, then we can pull back the asset and try again. So we do that through diligence milestones or commercialization milestones. Alternatively, certain technologies may attract enough interest from funding sources or prospective management teams to actually incorporate a startup. Startups still have to license the technology just as another institution or licensee would, but Typically, the invention team and NCH take a more active role in the business. We also enjoy a greater share of the proceeds, but it takes a lot of time and effort because there's business management that goes along with that and strategic direction that we have to provide the company. But in either case, we do a licensing deal, which that process can take anywhere from, on average, 2 to 6 months, but it could take longer. And before we move on from this slide, I'd just like to take a moment to say that this is a process of trial and error. And it really is a cycle that at any point, we may need to return to the beginning and reformulate an approach. This slide also doesn't show that even after marketing the technology and maybe even licensing the technology, we might take the technology back and try again. We've done that successfully. I like to say, for anyone who likes to, who has aspirations or is in the middle of this process, commercialization is like starting a restaurant. Within 5 years, most restaurants close. And it doesn't mean that people don't start restaurants. It means that you listen to the market and you do everything you can to make it successful. And if there is one thing that I think makes someone an innovator, it is resilience to the word no and resilience to failure, because you will hear it and it shouldn't stop you. It means that you need to take a step back, reformulate, and move forward with that new information. I like to bring this up to people as I first introduce them into this process, that we incentivize innovation at NCH. Part of our intellectual property policy, it covers everyone in the institution, not just our faculty, but our staff members, our administrative staff. A good portion of my portfolio is from administration itself. And we incorporate them into the proceeds of our research. For every dollar that comes in the institution under $75,000 net, the innovator receives 50% of that in their paycheck. And after $75,000, it's 33% to them. And it's really a recognition of the fact that it is a difficult and non-trivial amount of work that goes into commercialization. And there's also the intangible value of the intellectual property themselves that came from the investigator. And it's important to allow them to share in those proceeds. And finally, although it isn't the subject of today's talk, our office provides support beyond just commercialization, because our primary directive is to maintain and cultivate intellectual property that is generated out of the research and clinical enterprise of the hospital. And so in order to do that, there are many ancillary tasks beyond just licensing that we do. We talked about prior art review, but we also manage the entire patent docket of the institution, as well as interface with regulatory and other types of IP like copyrights and trademarks. We have a whole marketing function, which I talked about, and event planning. That's very important to do what we do, because although 80% or 70 to 80% of the leads that we get for technologies come from the investigator and just their scholarly function, the rest of those are made through a tremendous effort, which is sometimes low yield, to attract and get involved other types of business leadership. Additionally, out of maybe the 3,000 agreements that the entire hospital executes a year, about 1,000 of them are primarily negotiated by our department. That includes, as Prashant mentioned, confidentiality or non-disclosure agreements, material transfer agreements, data use agreements. And I would say the majority of our customer-facing interaction at the institution is from these types of activities. For example, an investigator may go up to the IRB and for a new clinical trial. It's not uncommon for the IRB to recommend that a data use agreement be used for interaction with our another institution, and they get integrated into the system. That's when we might do a prior art search about a piece of the intellectual property they might be generating, or it might be that we find out that there's some third-party obligation that we need to discharge, that we're using materials from a different institution that may not be able to use in that capacity, so we need to renegotiate, and that's what we do. We also do startup incorporation, and I think finally, the tech transfer organization at NCH has a unique perspective that kind of overlays a lot of the administrative function of the institution. And we are conversation with all of those pieces. So if there's anything that you don't know happens, that you don't know where it happens, I got an agreement or there's a process or a committee, your licensing associate or your connection with the tech transfer office can be a good first stop, because if things are operating as they should, I should know exactly where you need to go. And I might even know the person that you can talk to. And I'm happy to operate in that capacity. And finally, we do provide some gap funding, which I won't go into because I'm going to give it back to Matt, and he'll tell you about some of the other support, financial support that NCH may be able to offer you.
Great. Thank you very much, Andrew. I appreciate that. And I appreciate all of the work that Andrew and people like him do on our team. They really help this engine to drive. With the next few minutes that we have, like I said earlier in the talk, I'm not going to dig into detail on any one of the topics that I bring up. These are all meant to be kind of a short little advertisement for some of the resources that we have at NCH and in the Office of Technology Commercialization. But what I would encourage you to do is, I believe these slides are all going to be available. You have my contact information, you have Andrew's contact information. At the end of this deck, there is a general office contact info. If anything that we put up is of interest to you or you'd like to learn more about, please reach out and we'll be happy to accommodate that. If we could advance to the next slide. What I'd like to do for the next few minutes is talk to you a little bit about kind of our philosophy as an office and as an organization about the way we can best affect commercial translation of a technology and how we do that. There's a lot of different approaches to it. It's a hard thing to get done. You can go to talks where they talk about the gap between academic research and commercial viability, and whether that's traction with a licensee or with a group of investors or a management team. It's a hard valley to get across, and we think that there's a lot of different ways you can approach it. You'll find organizations that put a lot of resource into hiring entrepreneurs in residence, or to building marketing plans, or doing a market analysis, or a big business plan. And there's nothing wrong with any of those things. They have their time and place. They're things that we've done ourselves before. But often what we've done in our office is really try to focus resources and in our institution on how do we advance the stage of development. We think this is one of the most effective ways to attract a potential partner to a technology or to something that we've been working on. And I just want to introduce you to a couple of ways that we do that today. So we could go to the next slide. So the first resource I want to talk about that we've seen really have an impact here at NCH is our GMP capabilities, or formerly was known as our GMP facility. So if you are not familiar with NCH and our research program and commercialization program, gene therapy has absolutely been, one of the areas that we've had some of the most success commercially as an institution. It's certainly an area where we focused. It's not our only area of resource, but it's an area where we focused a lot of resources as far as commercialization goes. And one of the ways we were able to facilitate that was by developing an internal capability for manufacturing, in this particular case, AAV product that's relevant for carrying out clinical trials and doing clinical stage research at the institution. This principle remains an important part of how we advance technologies within our gene therapy program. And we've actually now partnered with a company called Andelin Biosciences that was launched from NCH in 2020, and we still have a special relationship there to do this. But the concept of internally having the capability to manufacture and to provide, clinical materials, clinical grade materials to the success of advancing your program is very deeply rooted in NCH and our culture. It's something we look to do very early on in a program. Another really important piece of resource we have here at NCH is our Office of Regulatory Affairs. This on its face sounds so simple and kind of mundane, but the impact is tremendous. I would argue that Kevin Bossi and his team of regulatory experts that are here at NCH, you could put them head to head with the regulatory affairs staff of many biotechs and pharmaceutical companies that you may know of and you've heard of, and they would trade blows and come out looking like experts, because they really navigated a lot of territory with the FDA for us and for our faculty, as they just kind of understand from the earliest stages of a program and the pre-IND meetings, authoring of the IND and putting that application together, submitting it, working to respond to FDA communications. A group like this has allowed us to create assets that are tremendously attractive to commercial partners and really do advanced stage of development. Next slide. You heard the team today and hear me read talk a lot about Resi, which is our Research Information Solutions and Innovation group at NCH. The Resi group really is kind of a group that's a jack of all trades, in that we've sent so many different projects to them over the years that are just been introduced by them to, or from them to different projects over the years, where they're involved in helping with design or helping with productization of an idea, or just building building out the concept further than maybe the clinician initially was able to fully get their head around. Introduction to resources that weren't necessarily obvious to the innovator that's going to be working with them. So the Resi team, tremendous resource here at NCH, is something a group that we try to communicate with as much as possible. Our Clinical Research Services group. This group is really important in that I think they do a tremendously good job of conducting clinical research, as you would expect most places, and that have kind of a bench to bedside focus and intention with their research. But I want to give our Clinical Research Services group the credit of taking everything they do to this next level, where they have a sophistication that allows them to interact with commercial partners. And that's a difference that I don't fully understand, because it's not the world that I live and work in. But over the years, I've grown to appreciate that what the Clinical Research Services group does is not just conduct clinical research, but the way they track data, the way that they support and back up their data, and the way that they're able to communicate things to regulatory authorities and to work with investigators to design the trial in such a way that it's not just publishable, but it's consumable by the FDA and by a commercial group, has been a really important thing that we've utilized here. And then if we go to the next slide, and this is actually kind of digging into the area you heard the team today mention a little bit, and where our office manages gap funding resources, and that are different funds that we've established to help launch technologies. Specifically, I can put them into two groups. The first is for unlicensed technologies. You heard us talk today about the Technology Development Fund, which is an internal accelerator fund mechanism we manage at NCH. We can give awards anywhere between $50,000 to $100,000 for projects that are pre-licensed, that have been able to identify to our group a series of experiments or a prototyping endeavor, or something that will actually advance the bar as far as stage of development and create a value inflection point for the external stakeholders that we're trying to engage with. And we've also grown this out a step further into a program with the state called the Technology Validation Startup Fund, Phase 1. And these are awards that are very similar to the TDF that we run here at NCH. They're a little larger. We could have awards up to $200,000 in scope, and they are focused on technologies that will be the subject matter of a startup company here in Ohio. And so that is one limitation around that. And then also, as a credit to the institution, our institution has leaned in on creating seed funding mechanisms for NCH companies that launch and that are looking to do a seed round. And so what a seed round is, for those of you who aren't very familiar, sometimes in the earliest stages of a company, when they first launch, they can identify what's the first big milestone our company needs to get to, and how many dollars would it take for us to get there. Maybe that number's 3 million. Well, what if, the most difficult thing in raising that 3 million is the first million in the door, or the first 500,000 in the door. We've found that by having these different seed funding mechanisms, which you see listed here below licensed technologies, we're able to help catalyze that process for companies that are working with NCH. And maybe $1 million in the door from our Catalyst 2 fund is what actually attracts the other venture money around the state or around the country to come in as well, and have successful seed rounds for our companies. We've got great examples of where that's worked. I would be remiss if I didn't point out that Rev1 Ventures has been a tremendous partner to us at NCH in all of the seed funding and venture funding mechanisms that we've tried to deploy for NCH companies. And so then if we could advance to the final slide here, the last thing I want to point out, and just as a disclaimer in case I misspeak, I am not part of the CCTS formally. I'm certainly not an expert. Tremendous supporter and very thankful that they're here. I think we did have an individual from CCTS that was scheduled to present today and unfortunately was not able to. And I just want to make sure that I point out to the group that this voucher program that they run is tremendously valuable and important as the group testified today. It had an impact on them and being able to get off the ground. The voucher program exists to support new collaborations, either between different colleges within OSU or between OSU and NCH. The vouchers must include 2 investigators from 2 or more colleges and institution. And as I said before, it's to support interdisciplinary work. I think the most important thing here is that we have a link. I would encourage you to follow, read as much as you can about this wonderful CCTS program that's here in Columbus, Ohio, and within our institutions at The Ohio State University and at NCH. Tremendous resource, tremendous people, and I would encourage you to explore it. But with that, I will shut up and I think move us to the question and answer session. We'd be happy to field any questions that you may have around our operation.
Hi, thank you, Matt. Thank you, everyone. Will our panelists please come back for the panel discussion? I want to start off with a deep appreciation. I hope you all saw the claps that came in, virtual claps for your wonderful achievement and how meaningful it is for, especially for the children. So my first question is going to be directed to John. John, you bring a completely different set of skills to this innovation. So could you share a little bit about how design thinking is critical to app development and what role you played in this process? Thanks.
Yeah, sure. So I'm a designer and developer of digital applications and interactive media. That's my role in the project. And so I kind of want to answer this question in kind of like 2 ways, one to talk about process and one to talk about the actual like design itself. So I think, as mentioned kind of in the presentation, our team works with an iterative design process. And specifically, that means that we quickly prototype features and designs so that we get feedback from stakeholders kind of early and often rather than like at the end, when it's not as useful. And as mentioned, we engage our target users in focus groups to make sure that, that we're on the right path, but also to get the kind of invaluable first impressions of what we're making. When you're in the kind of weeds of what you're doing, it's hard to see what you're actually creating and how it's affecting, or how it could affect the people that are supposed to be using it. Mm-hmm. And the idea of working in this way is to create not just for, but kind of with the community that you're serving, and to keep them close throughout the process, not just, once it's done. So then in terms of the design itself, full disclosure, I have a bias for aesthetically pleasing media. I like to make things that are pretty and fun. And I mean, yes, what is beautiful, what is fun, it's subjective, but you want to make sure you're designing for a specific user. But the thing is, good design, it serves the goals of any project, because it's not enough just to make something that's functional, let alone, like innovative. If you make something that's enjoyable, that your target user wants to engage with, then this kind of constellation of really great features that you've dreamed up will consistently end up in the hands of users and not just, gather dust on some virtual shelf.
Thank you, John.
Yeah, so that's like design, process, the thing, why they're important, and what I did.
Wonderful. Thank you so much. I love that you mentioned the end users. We have, our program has developed a co-design studio specifically for that, with trained end users, patients, community members. So thank you, John. Dr. Durbin, I think, do you have a question for the group?
I do, and maybe it could be answered both by the research team as well as by the OTC team, because I noticed in the presentation that it looks like, I think Prashant, you said one of the next key steps is to form a business entity. And I know from my experience working with Matt's team that there's always this question of whether do we take this technology and spin it into a new company or license it to an existing company. I don't know if your comment was meant to imply that we're contemplating spinning this into a new company, but I'm just curious, from the inventor and faculty members' perspective, how do you see the advantage and disadvantage of those 2 approaches? And then Matt or Andrew, if you want to provide your experience perspective on that too, because I can imagine in any innovation, development, that there always comes the point where you have to decide that. So just interested in perspectives of the folks involved in this technology.
Yeah, I'm happy to answer, and then Anand, if you have anything to add, please feel free to do so. I think this is sort of, we're active with the phase we're in right now, trying to figure out what our next step is going to be. So we've been having a lot of conversations with Andrew about this, as well as looking to see. Right now, we're doing a market analysis of what the world thinks of something like this, and so I think that's really important for us to inform us like what our next steps are going to be, or whether, as academics, we're like, okay, well, we need data, we need to prove it's right, and then there's a whole other step I don't know how to do yet about creating this business. I don't have the time. I have a nice, full-time job that I'm not going to be CEO of a company. So there's a lot of things here about, okay, well, do we create a business? Do we work on the licensing side and spin this off somewhere else, or have somebody else take this further? I mean, honestly, we're actively in this stage of trying to determine these things. Interestingly, I think we could, if we want to go the SBI or STTR route, then having a small business entity as part of that is essential too. So I'm sort of thinking we can go an academic route, or we can go really more the straight up, more commercial route. I'm sort of, our group has talked about sort of trying to do both in parallel right now, see what happens from the marketing side and make decisions as we go forward. I don't have an answer for you just yet.
Thank you, Prashant. That's helpful, and it's a typical answer I think we would see from a lot of investigators. I mean, Dennis, I think the easiest answer to your question is we try really hard to not be biased one way or the other, and to assess each situation on its own merits for what we recommend makes the most sense. And every time I've tried to give kind of a recipe for this is when you do a startup. I find somewhere down the line a technology that just breaks that rule. And so I think, a lot of it has to do with funding, access to funding, and access to interest. If a company comes along and is tremendously interested and they're willing to deploy dollars into the development of the technology, then it often makes sense to go ahead and give up some of the control around how it moves forward, because it gets such access to that resource. And like Andrew said earlier in his talk, we can use the license agreement as a mechanism to compel that licensee to stay on point with our mission and to stay aligned with us. However, in the event there's not a company, maybe there are programs like SBI or STTR or other state-derived programs that are focused on startup companies. That might be a strong motivator to say, hey, we need access to the $1.3 million to advance this technology right now. And the only way we're going to get it is to launch a startup company and try and go after some of those startup funding mechanisms. And that's a strong driver. The one thing I would say, because it's a theme that's kind of come out, and I think it's an important one, our office highly recommends that if we go the startup route, you let our team work with you to find an entrepreneurial partner or a business lead or some sort of a management team that we can partner with to do the startup company, just for the very reasons that Dr. Malhotra was saying a few moments ago, which is just, everybody has a full-time job, and it's not trivial to start a company and take it forward. And so our office would work really hard to try and find that right fit for each individual technology. So that's kind of the long dodging actually answering your question answer.
Thank you so much. It is time to come to a close. Dr. Durbin, did you have a comment?
No, I also just wanted to congratulate the team. It's a
Yes.
fantastic application. Best of luck moving forward. I'll look forward to hearing about the results of the trial. That's really exciting.
Thank you so much, everyone. I do have a few final announcements and sharing about the next month's showcase. Thank you all for joining us. Thank you, Dr. Durbin. Thank you to all the speakers. Next slide. Yes, and thank you to our partners, our mission partners, and our next month's speakers are Dr. Nimji and Wayne Embry from Inventors and Frank Norris. Please join us on December 14th, Tuesday, to hear another inspiring innovation entrepreneurial story from our campuses. Thank you so much. Have a good afternoon. Bye.